Antacids are a group of medications commonly used to neutralize stomach acid, providing relief from conditions like heartburn, acid reflux, and indigestion. These medications work by reducing the acidity in the stomach, offering symptomatic relief from the discomfort associated with excess stomach acid. Some antacids, such as omeprazole and lansoprazole, fall under a category known as proton pump inhibitors, PPIs, while others like ranitidine and famotidine belong to the class of H2 blockers. Both of these classes serve to alleviate symptoms of acid-related disorders but function through different mechanisms. Omeprazole is one of the most widely used proton pump inhibitors, PPIs. It works by binding to and inhibiting the proton pump in the stomach lining, which is responsible for the final step in acid production. By blocking the proton pump, omeprazole effectively reduces the amount of gastric acid produced, providing long-lasting relief from acid reflux, heartburn, and gastric ulcers. Omeprazole is often prescribed for conditions like gastroesophageal reflux disease, GERD, Zollinger-Ellison syndrome, and to promote healing of peptic ulcers. It has a longer duration of action compared to other medications like H2 blockers, typically providing relief for 24 hours after a single dose. Omeprazole is available over the counter in lower doses and by prescription in higher doses. It is typically taken before meals to ensure its effectiveness in reducing acid production. Since it decreases the amount of stomach acid, omeprazole also helps in healing damage to the esophagus caused by acid reflux and provides protection against further acid-related injury. However, long-term use of omeprazole can lead to certain side effects, including nutrient malabsorption, such as vitamin B12 deficiency, increased risk of bone fractures, and an elevated risk of gastrointestinal infections, as stomach acid plays a role in controlling harmful bacteria. Therefore, omeprazole is generally recommended for short-term use or at the lowest effective dose for chronic conditions. Lansoprazole is another proton pump inhibitor that functions similarly to omeprazole by inhibiting the proton pump and reducing stomach acid production. Lansoprazole is used for treating conditions such as GERD, peptic ulcers, and Helicobacter pylori infections, which contribute to stomach ulcers. It is available both over the counter and by prescription, and is typically taken once daily before a meal. Lansoprazole has a similar side effect profile to omeprazole, with risks such as nutrient malabsorption, bone fractures, and infections associated with long-term use. It is also used in combination therapy to eradicate H. pylori in people with ulcers caused by this bacterium. Both omeprazole and lansoprazole offer more sustained acid suppression than H2 blockers, making them more effective for conditions requiring prolonged reduction in stomach acid. H2 blockers, such as ranitidine and famotidine, work by blocking the action of histamine at H2 receptors in the stomach lining. Histamine normally stimulates acid production, so by blocking its action, these drugs reduce the amount of stomach acid produced. H2 blockers are generally faster acting than PPIs, providing relief from heartburn and acid indigestion within an hour. However, their effect lasts for a shorter period, typically around 12 hours, and they do not suppress acid production as thoroughly as PPIs do. Because of this, H2 blockers are often used for milder forms of acid reflux or as a supplement to other acid-reducing therapies. Ranitidine was once one of the most commonly prescribed H2 blockers for treating conditions like GERD, peptic ulcers, and heartburn. It was widely available over the counter and also in prescription strength. However, ranitidine was recalled from many markets, including the United States, due to concerns over contamination with a carcinogenic substance known as NDMA, N-nitrosodemethylamine. This recall has led many patients to seek alternative medications. Famotidine, another H2 blocker, is still widely used as an alternative to ranitidine. It works in a similar manner by blocking histamine receptors in the stomach, thereby reducing stomach acid production. Famotidine is used to treat GERD, peptic ulcers, and indigestion, and it is available both over-the-counter and by prescription. Famotidine generally has fewer side effects than PPIs and is considered safer for long-term use in certain patients. However, like other H2 blockers, it is less potent than PPIs, and its effectiveness may diminish with prolonged use due to the development of tolerance. Famotidine also has fewer concerns related to long-term complications compared to proton pump inhibitors, while H2 blockers like ranitidine and famotidine are effective for short-term management of acid-related disorders. They are generally not as powerful as proton pump inhibitors in providing relief from severe or chronic acid reflux. They also tend to work better for occasional heartburn or when taken as needed for relief, rather than as part of a long-term treatment plan. The main advantage of H2 blockers is their relatively low risk of side effects compared to PPIs, and they are often considered a first-line treatment for mild GERD or as a supplement to lifestyle changes and other medications.